It's been such an honor to bring all these practitioners together to share these stories with you and hopefully set up what is a very exciting future for the future of medicine, where we can shift from the old story of separation to the new story of interconnectedness. And the plan that Sheila just laid out for Ashland is actually a good plan because it's working in other places. If you're British like me, you know that Frome is said Frome and not Frome. But in Frome, they say the town that's found a potent cure for illness is community. And Frome in Somerset has seen a dramatic fall in emergency hospital admissions since it began this process. And you see in the bottom right corner there, the blue zone. So the blue zone research that went around the world looking for the healthiest communities, they brought back those ideas to a town in Minnesota, and health costs went down by 40%. Now, the problem with that, who do those benefits accrue to? If you reduce healthcare costs by 40%, who do those benefits accrue to? The insurance company, right? We have a fundamental issue with interconnectedness in that the basis for how we interact with the medical system is built on a story of separation, which is health insurance, and you can see it in that diagram there. And so ultimately, what we've been looking for all the way through is been looking at what are structures that have the right incentives. And a few years ago, when I first, for the first 8 years that I lived in America, because I was relatively healthy and I had a lot of doctor friends, I was uninsured. I was uninsured for the first 8 years that I lived in America. And then I had a child. And I realized that the value proposition was probably not the same thing, and I needed to get some insurance. But it's all very expensive. I lived in New York. And so, one of the things that I came across as I was doing the research were these things called a Christian health cost-sharing ministry. Has anyone ever heard of those? Right, so yeah, you guys are smart. You've heard of it. So the Christian health cost-sharing ministry, there's actually 5 of them. There's the 4 on the left and then Liberty on the right. So the thing that they have all in common is that they were given an exemption to the ACA mandate. So if you had one of these things, you didn't have to pay the tax penalty. And they were way cheaper. And you had to, they're way cheaper, and the incentives ran in the right way, because it moved from an idea of personal responsibility to an idea of community responsibility. But you had to be Christian to sign up, and for that reason and a few others, it never reached the mainstream, even though more than 500,000 Americans today use Christian health ministries. And I thought to myself all the way along the time, wouldn't it be amazing if our community, the practitioners, could start their own health cost-sharing ministry? But it wouldn't be a ministry because it's not Christian. But wouldn't it be amazing if we could build something like that? And I looked into it and I found out that there were only a certain number of exemptions given. And even though we've got a healthy community of practitioners who take healthcare seriously and take their own health seriously, that are perfect fit for that kind of thing, we couldn't do it. And we actually, if you've been following us for a long time, in 2015, we actually created a product with Liberty HealthShare, which you'll see over there. And then Donald Trump, 90 days ago, signed his tax bill. And although that's been unbelievably controversial in all different kinds of ways, my unique understanding of the situation, based on the fact that I've been in functional medicine and using those Christian health cost-sharing cooperatives, is that right now, we have the opportunity to do it, because the individual mandate has gone away. We're not forced to buy health insurance as a result of that. And so for the next 3 years, there is an opportunity for us to create something truly unique. And it goes beyond what a health cost-sharing ministry does. And these were the details there. And so what we're proposing and what we're going to be starting to launch today, and we're going to be launching and talking about all the way through our tour, is the idea of a health cooperative. It's more than a health cost-sharing ministry, because we're not just sharing the costs. We're actually sharing the health. We need to incentivize people to get healthy, and more than anything else, we need to incentivize people to help each other. There is no incentive in medicine that has been an evolutionary imperative for the last million years for us to support each other. And that incentive is not here in medicine, and it needs to be brought back. So for the next 7 months, and including this tour, we're going to be going on and talking about this beginning of a new health cooperative that we're launching here. And I had to launch it in Ashland because it's so aligned with the way that you guys think about the world. So if you're watching this video, you can go and click below and sign up. And I created a book called The Top 10 Ways to Save Money in Healthcare. If we're going to be a cooperative, the first thing is friends don't let friends pay retail for medicine. And as an example, if you just go to use your insurance to get a lab test, like say homocysteine, you could pay $737. But if you go directly to the labs, which you can in 47 states in the nation, you could pay $17.50. That's a saving of 98%. And if you have a high deductible plan, you're paying it anyway. So you might as well work it out. So this is the new vision for medicine. kNew is all about combining the right incentives with the right care. We've got the functional integrated medicine community. We've worked out over last year how to scale it up by using health coaches. And we are going to be going city to city to 40 cities all across this country. By the time that open enrollment starts on November 1st, we want to have 10 to 15,000 people at least that are committed to joining the first health cooperative and set a new vision for the way that medicine is done. We've said for a long time, the next functional forum is the 5th or the 7th of May, and we're going to be going into it deeper. We've said for a long time on the functional forum that community is the guru of the future, that Thich Nhat Hanh quote. Well, ladies and gentlemen, community is the guru of the now. Thank you very much.